This Week in Virology, the podcast about viruses, the kind that make you sick. From Microbe TV, this is TWiV, This Week in Virology, episode 1226, recorded on the 12th of June, 2025. I'm Vincent Racaniello, and you're listening to the podcast all about viruses. Joining me today from Scotland, Daniel Griffin.
Hello, everyone.
You're outside. It's a great background. You're on the water there, isn't that right?
Yeah, I'll move to the side so people can see a little bit.
Look at this. Beautiful green grass, water, skies, cloudy, typical Scotland, cloudy skies, right?
Yeah, there's a nice loch behind me. I'm in the Outer Hebrides on the island of Lewis. And it's been classic Scottish weather. I'm recording outside because this seems to be the place with my best signal. So hopefully this will all work. But it's been beautiful. But we got a lot to cover, Vincent. Oh my gosh! While I've been out of the country, what are you guys doing over there?
Oh, we're making a mess of things, Daniel.
All right, let's jump in with my quotation. Ignorance is not bliss. It's a missed opportunity. And that's by Adam Nicholson. And this is it's actually a book I'm reading right now, Sea Room, An Island Life in the Hebrides.
You going to move there, Daniel?
I really like it here, I have to say. It is very attractive.
Can you sail?
Yes, amazing sailing. Oh, there's all these wonderful, the islands and all these wonderful fjords. You could sail up into the fjords. It is spectacular. And apparently here they're very happy with science. So interesting enough, but let's jump in. I will start off with the attack on science section. So I suggested last week that integrity in science, and I will suggest for many endeavors, that investigation should precede ideology. You know, we are curious, we investigate, we discover, and then we try to understand the facts. We do not start with our conclusion and then ignore the facts and invent our own facts. So a couple things right off. So this week, and this story has evolved, but vaccine opponent hired by RFK Jr. scours official records for link to autism. So David Geyer, previously barred from accessing the vaccine safety data link for misuse, is now attempting to reanalyze its data. Geyer and his father, a geneticist who died in March, spent decades promoting the idea that vaccines cause autism. They published dozens of articles on the topic and developed a treatment dubbed the Lupron Protocol that involved giving children a drug that suppresses the production of sex hormones. A Maryland medical board later revoked Mark Geyer's medical license, and they disciplined David Geyer, who's not a doctor, for practicing medicine without a license. So that's who we're supposed to hear from about whether there's a link or not. A guy who practiced medicine without a license and was injecting children with Lupron. So, all right,
just almost too crazy to be true.
I mean, it's crazier. You know, it's one of those when they say, "Oh, the truth is crazier than the story." I mean, this is just it's like out of a bad novel, and no one would even believe it. Now, like, nah, it doesn't really happen. So, can't suspend my disbelief that much. But you know, the RFK Jr. connection with David Geyer goes back many years, and part of the story is the publication of the article "Deadly Immunity," published in Rolling Stone, later corrected, ultimately removed. And this was this article full of lots of misleading comments, clear inaccuracies. And I'm going to leave an article, a link to an article by Carrie Lauerman that really gives a lot of context. What was this crazy article, Deadly Immunity? And I'm really, I was sort of thinking like, okay, well, that's enough for this week. I'm going to dread what happens next. What will be this next report? But we already had quite a bit going on. And first, right, I think some of our listeners may have always caught this. Well, some comments here, but the U.S. Department of Health and Human Services announced on June 19th plans to reconstitute. This is a nice way of saying reconstitute the Centers for Disease Control and Prevention Advisory Committee. Well, they fired the 17 current members. And then what did they do? RFK reconstituted this with an advisory board And we read, right? So, and this is RFK writes himself this article, this commentary in the Wall Street Journal. Today, we are taking a bold step in restoring public trust by totally reconstituting the advisory committee for immunization practices. We are retiring the 17 current members of the committee, some of whom were last minute appointees of the Biden administration. Without removing the current members, the current Trump administration would not have been able to appoint a majority of new members until 2028. So basically, if you go through this article, RFK Jr. is accusing the members of having lots of conflicts of interest, just rubber stamping all vaccines up for approval. This reminded me of the Maha, report, where you go through and there are these 3 citations, but they're really, I mean, you see these articles, and one is this UPI investigates the vaccine conflict, published in 2003. So it's 22-year-old piece. And then there's CDC's ethics program for special government employees and federal advisory. This goes back to 2009. It really is just a general review, and it makes recommendations for how the CDC can follow 7 recommendations. And then, since the time of our review, CDC indicated that has begun or plans to implement improvements. So sort of accusing the CDC of having all these problems from, stuff 20 years ago, which we know why, because these are the same, counterpoints that when, Robert Malone pays RFK Jr. $1 million a year to spew anti-science, that, well, these are the same things he's been talking about for 20 years. So who's going to be on the new panel, Vincent? I found this news cycle moves quickly because we already have a list of 8 new members: a psychiatrist, a biostatistician, expert in healthcare analytics, a biochemist, a pediatrician, an ER doc, a public health and critical care nurse, an obstetrician. But I think there's a couple that really have people's hackles up. One is Robert Malone, and some of our listeners, maybe we'll talk more about him in the future or not. We have Martin Kulldorff, one of the lead authors of the Great Barrington Declaration, which was the sort of let it rip. It's really only a problem for other people, people over 65 and people with health problems. Now, Kulldorff was actually an individual who was fired from his hospital, Mass General Brigham, in a dispute over the hospital's requirement for vaccines. We also have Retsoff Levy. Remember, these are people who are objective, but if we look at his post on X, the evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people. And also, there is a woman on the list, Vicki Hebsworth. She's a nurse. She has a PhD in public health, and she serves on the board of what sounds like a great center, the National Vaccine Information Center. But what is that? I'll leave in a link. It's actually an organization criticized as a leading source of fear-mongering and misinformation about vaccines. And it's going to be a tough one because when we read her bio on the website, she says that she's the parent of a vaccine-injured child. Her son, her only child, experienced serious long-term health problems following receipt of 7 live virus and killed bacterial vaccines administered during his 15-month well baby visit, which sparked her interest in vaccine safety research, policymaking, chronic illness, and disability in children. And I have to say, I've already had physicians reaching out to me asking, like, what are we going to do? Where are we going to get guidance? Feeling that they're not going to be able to trust the CDC and ACIP as any sort of reliable source of information with this crew. And a couple quotes here from our buddy Paul Offit. The biggest hit here is the irony of it. RFK talking about regaining the public's trust. What he just did was he lost the trust of the medical community, so much so that people are thinking, should we try and create our own ACIP, our own vaccine advisory committee, because we can't trust this one.
The problem, as you mentioned, though, is that CDC actually generates a lot of the data, right?
I think there's a lot of issues here. Yeah, so the CDC generates the data. The CDC and everything under HHS with the FDA, they have a lot of issues with access, with coverage. Yeah. So this, even if reliable people say, "Here's the science, let's discuss it, let's make recommendations," those are not going to necessarily translate into access, into coverage. I know there's a bill in New York State right now to try to maintain access to vaccines, even if the CDC tries to take stuff away. So, not good, Vincent. And speaking of vaccine preventable diseases, we mentioned a little bit back, but pertussis, I know it's not virus, whooping cough, but on Friday, June 6th, Kentucky announced 2 pertussis deaths in infants. These are over the last 6 months. Neither the infants nor their mothers have been vaccinated against this infection. These are the first whooping cough deaths in Kentucky since 2018. So, not good there. And bird flu, I was out on a hike today with this fellow Daryl Brown, who runs Wild Harris, and he was very interested in discussing bird flu. But we have the article "Stability of Influenza Viruses in the Milk of Cows and Sheep" posted on medRxiv. And I thought this, even though it's only posted on medRxiv, it was worth just a mention. So here, these investigators incubated viruses in cow's milk under lab conditions at room temperature to simulate exposure to dairies, at 4 degrees C to stimulate exposure, basically being in the refrigerator. So thinking about folks with raw milk in these different conditions. And though the survival was variable, they consistently found there was substantial viral infectivity over periods when people might be reasonably exposed to infected milk for over a day at room temp and for more than a week when refrigerated.
So this is just for people who don't drink pasteurized milk, right?
It's raw milk again. It's people drinking raw milk. What are they doing? All right. And measles. Oh my gosh, Vincent. I was thinking things were quieting down. Looked a little bit better down there in Texas, but we're up from 1,088 to 1,168 confirmed measles cases. We're now up to 34 jurisdictions. I think we're trying for 51. Canada, actually, another 225 new measles cases. So they're up to 2,968 measles cases. And unfortunately, it's probably just a matter of time. But Canada's Ontario province reports the death of a child from measles. That's the first one, died in southwestern Ontario, Canada. So over here in the UK, I'm in the UK. We are having some issues here. Measles outbreaks continue with rise of holidays causing surge. I'm not sure what holidays these are, but we were hoping, right, things are going to go down in the summer. That's what we were hearing from our pediatricians who had lived through decades back. But when we looked at monthly update on measles cases in England, outbreaks are continuing. 109 cases confirmed in April, 86 so far in May. So we're here in June now. Cases have been predominantly in unvaccinated children under 10 years of age. Ongoing outbreaks in numbers of regions. London has about half of the cases in the last 4 weeks. And actually, interesting, the CDC has made some comments about, when you're traveling, make sure you're up to date with vaccines. So
You're in the UK. You better watch out.
I know. I'm far from London, so. All right, and flu. Actually, this is kind of some good stuff here. We'll talk about some actual science that's going on despite the world falling apart. The article "Oseltamivir, right, Tamiflu treatment versus supportive care for seasonal influenza requiring hospitalization." So is it worth it giving out the Tamiflu? Well, in adults with influenza requiring admission to hospital, is oseltamivir treatment within the first 2 days of admission compared to supportive care associated with a decreased risk of death in hospital. 11,073 patients, 7,632 got Tamiflu, 3,441 did not. We see a 3.5% in oseltamivir and 4.9% in those who did not. So we're actually seeing that getting Tamiflu was more likely to be discharged alive, more likely to survive. So really across the board, seeing a benefit to that. All right, and RSV, this is exciting, folks. So it is exciting for everybody. Another monoclonal for RSV. So just not nirsevimab. The U.S. FDA approves Merck's enflonsia. What a horrible name, I have to say, guys. Sorry about that. Enflonsia. I'll have some of the enflonsia versus the nirsevimab. The nirsevimab was just a better name. Sorry. But clesrovimab, C4, for prevention of RSV. In their first season. It's the first and only RSV preventive option with just one dose, right? So the nirsevimab, you have to do like a lower dose if they're younger, a certain weight, and a higher dose. Here's just one shot across the board. And these are based on the results of a phase 2b3 clever trial. That was catchy. Single dose enflosia administered to preterm and full term infants, birth to 1 year of age, demonstrated reduction in incidence of RSV associated medically attended lower respiratory infections. So basically, we're seeing a reduction in RSV associated hospitalization through 5 months by 84.3%. So really in line. So the approval is supported also by phase 3 SMART trial. I'm going to leave in links to all this. But CDC's advisory committee with the new folks on board, they're going to meet later this month, and this is going to be one of the things that they'll be talking about. Does the CDC recommend? I mean, this is a slam dunk. This is passive. This is monoclonals. This is stuff that everybody loves.
Yeah, but with these new bozos on the committee, Daniel, they're going to find something wrong with it, I guarantee.
This one I'm feeling good about.
I hope you're right.
All right. Moving on to the COVID update. I hate to say this, Vincent, but we're seeing a little bit of an uptick there out west. And this data is a little bit behind because I have to say, on some of the wastewater scan.org, we're actually seeing the levels come up, which is a little more recent. So I think that summer surge is going to be a thing. But, you and I, we're betting both sides of that. So we'll see what happens.
I don't know. I think it's just noise, Daniel.
Okay. Well, we will see what happens there. Okay, and we have a couple more to go. So long COVID. This is something I just got to keep reminding people about, right? People talk about like, oh, COVID wasn't so bad. We only lost, a little over 1 million people in the U.S. It's such a crowded country anyway. But forgetting about that, forgetting about the over 1,000 children that died and all the folks that ended up in hospital, just ongoing issues. We still see people struggling who got COVID, did not get better. And I always make a point. It's not just long COVID, that chronic fatigue type syndrome, but also other medical problems. And so here we have the article, Long-Term Outcomes of Patients with Pre-Existing Coronary Artery Disease After SARS-CoV-2, published in eBiomedicine. So patients with pre-existing coronary artery disease classified as those had COVID, those did not have COVID, PCR positive. I'm always amazed where you get all these COVID negative, no-vid folks. Here they're looking at the Montefiore Health System between March 11, 2020, January 12, 2024, 1,380 hospitalized with COVID, 1,702 non-hospitalized with COVID, some 7,264 controls, 8,492 historical controls. That makes sense. Primary outcomes were all-cause mortality, new onset heart failure, myocardial infarction, stroke, major adverse cardiovascular events, and compared to contemporary controls, folks hospitalized with COVID-19, but not patients hospitalized without COVID-19 had a higher risk of major adverse cardiovascular events, and it was about a 60% increase. And this lasted for actually up to 4 years post-infection, and lots of great figures, Vincent. So maybe the folks that are watching on YouTube will see this really big separation here. Survival probability for all-cause mortality. And I want to point out, that's what you want to look at, because something is going on here. It's not necessarily dying in the first week or two of COVID, but as you follow these people out months after, you see the people who were hospitalized for COVID really separating when it looks at all cause. When you look at first time having your MI, you just see this incredible rise for folks that ended up in the hospital with COVID. And when you look at congestive heart failure and some of the other parameters, and particularly stroke, I think for some of us, that's one of the worst things that can happen. So
if you go in the hospital, that's a big risk factor, isn't it?
Yeah, and I think it's kind of a question, and I think this is open to discussion. Are these people who kind of had something else going on, and when they got COVID, that's why they ended up in the hospital?
Yeah.
Or I think what we're sort of a growing story here is people seem like they're doing fine, and then they end up getting hospitalized with COVID, and that seems to be what really separates out your future. So, all right, and our last one. And this is our, looking at globally. And as we've been saying, no one is safe until everyone is safe. Well, Trump budget eliminates funding for crucial global vaccination programs. Another great article by Apoorva Mandavilli. Here we read that the Trump administration's proposed budget for the coming fiscal year eliminates funding for programs that provide vaccines around the world, including immunizations for polio. So this budget proposal submitted to Congress last week proposes to eliminate the Centers for Disease Control and Prevention's Global Health Unit, effectively shutting down its $230 million immunization program, $180 million for polio eradication, and the rest for measles and other vaccine-preventable diseases.
This is nothing but meanness, Daniel. There's no need to do this.
I mean, you look at his his golf Secret Service monthly budget. It's enough to cover these costs. I mean, we're not saving money here. I agree with you. This is very short-sighted.
I mean, the U.S. always did this because we could help other people, and that's the way it should be. Now this is incredible selfishness and inhumanity in the administration, which doesn't fit the U.S. at all.
Yeah, no, it doesn't. It's embarrassing, right? Because we have had this reputation for, winning over the hearts and minds throughout the world through just this generosity, this charity, these global efforts. And as we're seeing, right? I mean, we had gotten rid of measles, but now we're seeing, lots and lots of measles, and these diseases, they know no borders. So even from a selfish point of view, this is just really the wrong thing to do. This does not make anywhere great again. And so I will wrap us up here before we get with our emails by reaching out and saying, hey, we are doing everything we can here, but we can only do it with your support. So I'm hoping everyone will pause the recording right here, go to parasiteswithoutborders.com and click donate. Every bit helps. My buddy Brian Parks is out there in Uganda checking on our clinic. Things are really moving there, and because of your support. So for May, June, and July, we're right in the middle of our Foundation International Medical Relief of Children fundraiser. With all these cuts, we need your help more than ever. We're hoping to double those donations to get up to a maximum donation of $20,000.
It's time for your questions for Daniel. You can send yours to daniel@microbe.tv. Richard writes, Wide Awake Media posts that according to RFK Jr., Gardasil is probably the single worst mass vaccine we've ever seen. And here's a quote. Children who take the vaccine are 37 times more likely to die from the vaccine than they are to die from cervical cancer. Daniel, is that true?
This is not true, and this is the problem. You have people saying things that are not true. There's no good science to support this. This is a tremendous vaccine for preventing cancer. And we just have someone. Yeah,
Daniel, he just lies, and he doesn't care, and people don't call him out.
Yeah, and they need to. You really need to challenge, and we're going to keep doing it. Everyone needs to keep doing it. Because this is not right. We talked about this early on. When science and politics, you get politics. When politics get involved in medicine, you end up with dead children. And we said that, and now a couple measles deaths here in the U.S., a couple pertussis deaths. We just had the measles death up in Canada. This is not what's supposed to be going on.
Folks, tell your anti-vaccine friends that this is lying, basically, that Gardasil is completely safe and prevents cancer.
Yeah.
All right.
It saves lives. No, and I think you do have to have those conversations because people think it's fun and, conspiracy theories and all the rest, but we have children dying because of this lack of integrity.
Gretchen writes, I listen to your updates every weekend. Thank you for all you do to keep truth and facts about viruses and vaccinations. I stumbled on this old Gary Larson cartoon about vaccinations and thought, if this were different times, maybe it would be funny. On the other hand, maybe vaccination trucks cruising neighborhoods with medical and scientific information could be a way to get the rates up. Anyway, for your pleasure or displeasure, I am passing on the link. And here's a Larson of a guy in, looks like an ice cream truck, but it's the vaccination man. And the caption is, slowly he would cruise the neighborhood waiting for that occasional careless child who confused him with another vendor.
I think that's great.
Bob writes, thank you for covering the latest RFK Jr. announcement on excluding COVID vaccine administration for normal children, pregnant women, etc. Pharmacies are not in the habit of dispensing medications without a prescription. For those people in this huge excluded group who still want to get a COVID vaccine, will they now need a prescription to do so, or are these vaccines considered to be over-the-counter meds? If a prescription is needed, will the script have to state which type of COVID vaccine is prescribed? Thanks for all your hard work. One of your many dedicated listeners, Bob.
No, thanks, Bob. So I think one of the ways that they're going to be doing this is when people go on to schedule their vaccine, they'll basically be clicking boxes. And if the pharmacists are smart, they'll make it very easy. They'll have a list of these are potential qualifications. Do you have them or not? You don't want it to be a trick question. Like we see this when you're deciding you want to admit someone to the hospital and you end up on the phone with some high school student and you're trying to figure out well, what would you consider an appropriate, qualification to admit this person? And, they want to share your list and you're like, well, they met sepsis criteria, whatever. So yeah, the hope is, because right now it's really hard. Vinay Prasad went ahead and he said, listen, a third of Americans, under the age of 65, they're still going to be eligible. And we're like, yeah, and would you tell us what the boxes are that we're allowed to check? I'm sedentary. What do you mean by sedentary? My weight is over a certain amount. I have certain medical problems. What are those? So yeah, I think it just needs to be really clear. And hopefully it's going to be a way where you click the boxes, you show up, and the pharmacy can go ahead and give you that protection.
Kathleen writes, my husband is scheduled to present a paper at a conference in Sarajevo. Friends are warning us of the rising rat population there and the risk of disease, including leptospirosis and hantavirus. The CDC has a fact sheet that states doxycycline may be used for prevention. What do you think?
Yeah, this is actually kind of an issue there. So, they're seeing a lot of cases of leptospirosis. And depending upon your travel exposure, if you're going to be maybe swimming in fresh water or other exposures, doxycycline, 200 milligrams once a week might be advised. So yeah, talk to your doctor, talk to your travel doctor. It's kind of crazy. Like it's getting to this point where it's not just sub-Saharan Africa, Asia, you're heading to Europe and now you got to be checking with your travel doctor if you're worried about measles or leptospirosis or hantavirus.
But Hanta is not going to be stopped by doxycycline, right?
No. And actually, you're probably at low risk for Hanta because Hanta is something we see when you aerosolize the mouse droppings, right? So the virus will be in there, they dry, so you're cleaning. I don't suspect you're going to be at risk of that. But yeah, we are seeing a growing number of leptospirosis cases in that region.
Yeah, the Hantas don't come from rats. They come from mice. That's right.
Yeah.
And Susan writes, I wonder if you saw this article in JAMA. It references a possible reduction in actinic keratosis when HPV vaccine is given. I have quite a number of actinic keratosis spots. I'm also on immunosuppressant meds due to a kidney transplant, so I'm not sure how well I would respond to the vaccine. Given that information, do you think the vaccine might still be worthwhile for me if I can get it, age 71?
Yeah, it was an interesting article. That was in JAMA, I think, back in March. It was recent, and it was about 70 people in that study. And yeah, it actually showed this reduction. They followed out a number of months. I don't really understand the mechanism and the discussion. Is it something non-specific? What exactly is going on there? But yeah, so at this point, it's still an interesting observation. I don't think we're broadly recommending HPV vaccination for actinic keratosis, but yeah, it's definitely something to watch.
But this is not something you could do off-label yet, is it?
I don't think so. Yeah, it was. I think at this point, it's still such minimal data here. So yeah,
because the HPV vaccine is only good up to 45, right?
Yeah.
That's TWiV Weekly Clinical Update with Dr. Daniel Griffin. Thank you, Daniel.
Oh, thank you, and everyone, be safe.